legislature on the ballot that takes aims at dialysis clinics in California. Now, backers of this proposition that say that the clinics are taking advantage, that they're making too much money, not from private insurance, and they're not putting it back into the workplace.
That's right, but opponents of Prop 8 say it could put some clinics out of business.
You've seen the ads.
I urge you to vote no on Prop 8.
Proposition 8 asks voters to regulate the profits of dialysis clinics. And Dr. Brian Wong is an expert on dialysis and runs a clinic in Oakland.
Just setting a proposition, floating it to the public, without the public really understanding the intricacies of how healthcare is being financed in this country and in California, I think it's a flawed concept.
The first question is, why are we voting on this? David Reagan is the president of United Healthcare Workers West, and his union put Prop 8 on the ballot. He says they did it because state lawmakers wouldn't go for it.
The legislation, it was clear to us, could not pass the legislature and be signed by the governor.
Community dialysis clinics?
But why is the union spending $17 million trying to regulate non-union dialysis clinics? Well, the union has been trying to organize workers at these clinics for more than 2 years. Now, Reagan denies that this ballot measure is an attempt by the union to gain leverage over the clinics.
We're going to continue to talk to dialysis workers, whatever happens in November.
He says the real problem is that dialysis clinics are gouging people who have private insurance.
Basically, what they do is charge people who are not on Medicare and Medicaid 4 to 5 times more than people who are on Medicare and Medicaid.
According to the initiative, the 2 largest dialysis companies make almost $400 million in California each year. So far, they've raised $99 million to oppose Prop 8. Here's why. Prop 8 designates certain things like equipment and hourly wages as allowable costs, and then it limits the clinic's revenue to 115% of those allowable costs. But an industry-funded study by the Berkeley Research Group says allowable cost leaves out more than 30% of actual costs, things like the cost of security, administrators, and doctors. And if Prop 8 passes, 83% of clinics in California will operate at a loss. Dr. Wong says even the richest dialysis companies will close a clinic if it's losing money.
The clinic's going to fall in hard times. It will be operating in the red, and it won't be before long that operations are cut back and perhaps even close. Then where do these patients go?
Reagan says that clinics are not going to close, and he says dialysis companies will say anything to protect their massive profits.
I think it's classic fear-mongering.
The Legislative Analyst's Office says it can't predict what will actually happen if Prop 8 passes. Clinics might close or they might not. Dr. Wong says voters shouldn't bet that the companies are lying about closing clinics because the stakes are too high if they're wrong.
I don't own the clinic. I am very much fearful of what might happen to the patient.
Now, you heard in there about $99 million being spent. No, it went up to $111 million this last couple of days, making this the most expensive proposition we've ever had, even outdoing the pharma one a couple of years back on regulating drug prices.
Wow, that is just really outrageous. Well, and then the union, of course, is spending something around $20 million, certainly not even close to that amount, but altogether, you know, $150 million ballot measure. That is definitely record-breaking.
Now, there's a